Hello everyone, this is Dr. Kant Shah here, Pediatric Robotic and Laparoscopic Surgeon. So we've been talking about pelvic junction obstruction, antenatal hydronephrosis, ultrasound scan, EC scans, the surgery called pyeloplasty. So now let's talk about something which is very commonly discussed by the parents, that is the DJ stent. It is important to understand what this stent is, why it is put during surgery, how we remove it, and what is the recovery expected. The simple message to all parents is that the DJ stent is a temporary support and not a complication. It helps in safe healing after pyeloplasty. So let's start with what is a DJ stent. A DJ stent is a soft flexible tube placed between the kidney and the bladder, and it keeps the urine flowing freely after the surgery. It supports the repair while the healing takes place. So why is a DJ stent used after a pyeloplasty? Well, after every surgery, there is usually some tissue edema, or what we call in simple language as swelling. Due to this swelling, there may be a temporary blockage to the newly formed pelvic junction, causing an increased pressure to the urine flow, which may even cause a urine leakage. To prevent such a blockage and to reduce the risk of urine leakage, it is well proven that a DJ stent is very useful. It allows the surgical site to heal very safely. So the obvious question is a DJ stent required in every child? Well, yes and no. Yes, if you want to reduce the leak rate and enable faster and safer healing, then it is mandatory. No, because it is an elective decision taken by the surgeon during surgery. However, in practical terms, most surgeons prefer to use a DJ stent. Will your child feel the pain? Will your child feel the DJ stent from inside? Usually no. But some may have mild urinary symptoms such as bladder spasms, and you may even see a trickle of blood in the urine due to the stent or due to the repair, which is called the pyeloplasty. So how long do we keep this stent in? Well, usually a few weeks. As a surgeon, I keep it for 4 weeks. The exact duration is variable from surgeon to surgeon. Once healing process is supposed to be adequate, the stent is removed. And how do we remove it? Well, it is removed in children under a short general anesthesia, where a telescope called a cystoscope is inserted into the bladder and the stent is held with some forceps and pulled out. This usually takes only a few minutes, and there is usually no pain after this surgery. The child goes home on the same day and the recovery is quite quick. So when the stent is in place, are there any special precautions that parents need to take? You can ask your child to have good fluid intake, which will help both the healing process and having a stent in. If there is any fever or pain or difficulty in passing urine, then this must be reported urgently to the hospital. Stents can sometimes cause infections, and that is well known, particularly in small babies. Hence, usually in small babies, we would give a small dose of antibiotic until the stent is there. If the baby has a very high grade fever, then we may need to check for a urinary tract infection. So to summarize, the DJ stent is a temporary and protective measure to improve the surgical success, and in practice, we almost always use it during a pyeloplasty. Please do like, share and subscribe our videos, and there's more coming up on this topic. Thank you.